morning, everybody. Can I start by thanking our citizens for coming to get tested on a weekend? Today's number of tests reflect in large part what happened on Saturday, and we had more than 5,500 people come forward and get tested, which is excellent for a weekend. And of course, we're hoping to keep boosting those numbers over the weekend. And out of all those 5,500 cases that or tests, there was only one that tested positive, which is again a positive sign. As New South Wales moves into May and as we look to be easing restrictions, can I please encourage everybody to download the federal government's COVID Safe app? I've done it, and I'm normally someone who would worry about my privacy. I'm someone who would worry about people accessing my phone, but I have no concerns about this app, and I would ask everybody else to please download it as well. The more people that are on the app, the safer all of us will be, especially as New South Wales moves forward in easing some of those restrictions we've had to live with for the last few weeks. So can I please encourage everybody to do that? I also do want to outline the fact that this is the last week where children will be learning from home, where there'll be online learning, and obviously schools go back next week. I do want to foreshadow, which Dr. Chant will also mention, that there was a child diagnosed positive at Warragamba School. That school's now been shut down and will go through the normal cleaning process. And I say to parents and teachers and school communities, this is likely to occur on a more regular basis when schools go back, but we've demonstrated from our experience in Term 1, best practice when it comes to isolating a case, shutting down a school, doing a deep clean, and then resuming activities as soon as possible once contacts have been established. So whilst it's happened again today, I anticipate it will happen more frequently, but please have confidence that we've gone through all the processes and we know what it takes to keep everybody safe when that occurs. I also do want to stress that whilst it'll be a staged return to school from next week, the New South Wales Government has encouraged all of our public schools to expedite Year 12, and that was a guideline we'd put out. And I'm pleased to say that the latest report I received from the Minister for Education is that the vast majority, the overwhelming majority of public schools have been able to expedite classes for Year 12. So we anticipate next week that whilst most years will have a day or two of tuition, that Year 12, the vast majority of high schools have catered for extra classes for Year 12, which is a very positive sign. And as I've said previously, we're hoping that if the first few weeks go well, that we will consider bringing back full-time face-to-face teaching in a quicker way than we'd first anticipated. I also want to stress again that whilst we had been with some tough restrictions in the last few weeks, that over the weekend, and I've just spoken to the Police Commissioner this morning, we're very pleased with everybody respecting the rules and regulations. And again, a huge thank you to our citizens. This gives us heart that with the downloading of the COVID Safe app and the fact that everybody is trying to do the right thing, that we can move forward with confidence in looking at other restrictions to ease, and that is a positive thing. I really appreciate everybody's cooperation and support because it has made a huge difference. But as I said last week, we've also used this time to build up our health system, to build up our health supplies, and I'm very pleased to announce today, and the Minister for Health will have more to say about this, but the New South Wales Government invested massively in the new Westmead Hospital precinct, and today the Acute Services building will be open 3 months ahead of schedule. That's an extra 300 beds, 2 emergency departments. This is a huge investment, a huge precinct, which won't just be about providing direct health services, but also being an amazing research and development hub, a huge education hub. And the $1 billion investment in that precinct is one of the largest we've seen in a short amount of time in our health system. Incredibly proud of what's been achieved, and the Minister of Health will be able to provide further details. So thank you to everybody for your cooperation. We're definitely heading in the right direction to get a bit of normality back in our lives. Looking forward to having schools come back next week, and please continue to come forward and get tested, especially as the weather is cooler. Flu-like symptoms are likely to be more common and frequent, but please don't worry. If you have flu-like symptoms, it could be COVID. Please come forward and get tested. That is the best thing to do. We've got more than ample testing kits, more than ample ways in which you can get tested. And we're just so pleased that the number of people who came forward on the weekend, and we want that to continue every day of the week to get as close to the 8,000 number as we can.
So as the Premier's indicated, we've had one new case in the reporting period from 5,571 people. That's the highest number of case test results we've ever had on a Sunday, so thank you very much. We now have 3,033 confirmed cases of COVID-19 in New South Wales. There are currently 107 COVID-19 cases being treated by New South Wales Health, and this includes 14 people being treated in intensive care units, with 10 of those requiring ventilators. And 3/4 of our patients and cases are being managed in non-acute out-of-hospital care. The one additional case is from a 7-year-old boy who has mild disease and is being managed at home, who attended the Warragamba Public School. The school is being closed today, and the usual public health contact tracing will occur, and we'll also be aiming to identify a source for that case. There's been no new deaths in the reporting period, and that remains at 44 overall. In relation to testing, please continue to come out and get tested. We are urging anyone, irrespective of the level of symptoms, so however mild respiratory symptoms, the mildest sore throat, unexplained fever, cough, runny nose, more severe chills, or high fever like an influenza-like illness, please come forward and get tested. I want to acknowledge the Lithgow and Blue Mountains communities after calling out those communities last week. It was pleasing to see them turn out in numbers and get tested, which has assured us that there isn't more widespread community transmission in those areas. But again, we urge people in Lithgow and Blue Mountains to continue to come forward and get tested. There's several new areas this week, and some remain. So we've got Blacktown, Canada Bay, Cumberland, Inner West, Liverpool, Parramatta and Penrith local government areas. We still urge the community, in particular in those areas, to come forward for testing, as we are concerned and want to confirm that there is not chains of transmission occurring in those communities that are yet undetected. So again, anyone with respiratory symptoms across the state can come forward, but those areas in particular we want to focus on. Thank you.
Thanks, Premier. Good morning. I want to thank the people of New South Wales again for coming on the journey. This weekend we saw a relaxation in the isolation laws from Friday. There were 22 tickets issued over the 3 days. But if you go back to the previous weekend, there was over 100 tickets issued. So even though there was a relaxation, the people of New South Wales are still working hard, obviously, and taking this seriously, and I thank you for that. From a law and order perspective, we still see crimes down or stable, even though there are some challenges that we are facing at the moment. And I think it speaks volumes again of the New South Wales Police Force and the work that we continue to do with the community. We know the New Zealand Warriors landed in Tamworth on Sunday, some 48 players and staff. 5 of those were Australian citizens, and they are now isolating, just like every other Australian who was returned to New South Wales, in fact under stricter conditions. We know that there are other NRL clubs that are currently seeking to come into New South Wales and train from other states and territories, certainly which is a much simpler process. I'm on the record in saying this is all about employment, and NRL were not the first group to come forward to the CERCON. Clubs, New South Wales and the AHA have been in continual contact in terms of trying to get their clubs and pubs open again. Bunnings is a great example of making early contact and are a real example